Hi, this is Dr. Bhargava. In this short video, I have a few interesting cases to share with you. Our first patient is a 10-year-old boy who was passing blood per rectum, and a Meckel scan was performed using technetium-99m pertechnetate. On these images, the dynamic images, we can see that in the midline in pelvis, there is a focus that appears and becomes more intense with time. And so this patient was imaged for up to an hour, and we see physiologic uptake in the stomach. We see excretion from the kidneys into the urinary bladder, and we see this focus that appears and becomes more intense. This is consistent with ectopic gastric mucosa in a Meckel's diverticulum. This is a static image showing the same finding, and here is a graphic showing the Meckel's diverticulum arising from the distal small bowel. This is a good review article on performing the Meckel's diverticulum scintigraphy. And here is the rule of twos that Meckel's diverticulum is known for. So it's the most common congenital anomaly of the gastrointestinal tract. It's seen in about 2% of the population. It's about 2 feet from the ileocecal junction, and it's about 2 inches long or 5 centimeters. And most patients present before the age of 2 years. It can have two kinds of ectopic tissue, the ectopic gastric mucosa or ectopic pancreatic parenchyma, and these can result in ulceration or bleeding, and it is twice as common in males versus females. This is our next patient. We are looking at several images from an FDG PET-CT scan performed for an oncologic indication, and the finding is incidental. We see a focus of increased uptake, SUV max of 11.7 in the posterior aspect of the right ischium at the junction or where the muscle is inserting into the bone. And here is the finding on the fused image. This finding is consistent with esthesopathy, which is a benign cause of FDG uptake at the sites of insertion of muscle into the bone or at the sites of presence of a bursa. So esthesopathy has to be recognized as benign uptake on FDG PET-CT studies. And here's an article on the significance of incidental intra-articular and peri-articular FDG avid foci on PET-CT. This patient presented with rising PSA after prostatectomy. Let's start by reviewing the rotating image. So we see physiologic distribution of the tracer in the lacrimals, salivary glands, liver and spleen, excretion from the kidneys into the bladder. And then right here in the pelvis, we see this small focus of increased uptake. This is abnormal. This corresponds to this focus right here on the fused image, also seen on the axial PET image and the rotating image zoomed in. So this focus is recurrent prostate cancer at the site of anastomosis or local recurrence. So these are more images showing that focus in better detail. In this situation, when the patients have had prostatectomy and the PSA is rising, PSMA PET-CT picks up local recurrence or metastatic disease at very low levels of PSA. And here we see local recurrence. And so this graphic reviews pre and post prostatectomy anatomy. So here on the image labeled before, we see the prostate with the tumor inside. We see the prostatic urethra, and we see the seminal vesicles. And after surgery, this dotted line is the part that has been removed at the time of prostatectomy. So when the prostate is removed, the prostatic urethra gets removed with that, and so the anastomosis here is between the bladder and the remaining urethra, so it becomes a vesico-urethral anastomosis, and local recurrence occurs at the site of vesico-urethral anastomosis, and that's exactly what we saw on our patient. Here is a good related article on this topic. Thank you for watching.